Every year, millions of people around the world are affected by health emergencies, resulting from conflicts, natural hazards, or disease outbreaks. More than 1,200 health crises have been recorded in the past decade in 188 different countries, affecting people's health and livelihoods, and disrupting societies, economies, and systems. The United Nations World Food Programme, WFP, is the world's largest humanitarian organisation, saving lives in emergencies and using food assistance to build pathways to peace, stability and prosperity for people recovering from conflict, disasters and climate change. To assist more than 100 million people in over 120 countries and territories every year, WFP operates a network of 5,600 trucks, 30 ships and 100 planes on any given day, delivering food and other relief items to some of the hardest to reach places on the planet. Over the past 2 decades, WFP has put its logistics expertise and footprint at the service of health partners by procuring, storing and transporting health items on behalf of other UN agencies, NGOs and governments, whilst working to strengthen supply chains to better respond to health shocks.
My name is Silvia Rossi-Tafiuri. I'm the Head of Partnerships and Capacity Strengthening for WFP's health supply chain. Despite years of progress, according to the World Health Organization, more than half the world's population still lacks access to essential health care. Health emergencies such as Ebola outbreaks or the COVID-19 pandemic are stretching supply chains to their limits, making it difficult for countries to provide medicines, vaccines, and other critical health items to people in need. In 2020, WFP was selected as one of the awardees of the Takeda Pharmaceuticals Corporate Social Responsibility Program. Both organizations, in fact, stepped up to support the response to the COVID-19 pandemic. The partnership really helped address the urgent needs of the front lines of the pandemic, while providing long-term solutions to prepare the response to future emergencies. Throughout this video, I will be introducing different speakers from WFP and national partners who will explain the types of activities, tools, and processes that have been developed and shared so far throughout this partnership. First, let me introduce Ilse Larkin, a supply chain officer at the World Food Programme, to tell you more about the way Takeda and WFP supported the Global Humanitarian Response Plan for COVID-19 at the start of our partnerships in 2020.
In 2020, as planes were grounded and normal transport routes reached a standstill, the need to quickly find solutions to get life-saving protective equipment, ventilators, oxygen concentrators and other cargo across the world was critical. The humanitarian community looked to WFP as the leader in humanitarian logistics to help, requesting access to its logistics assets and expertise to enable the movement of health and humanitarian cargo to COVID-19 hotspots. This complex challenge needed a new set of supply chain planning tools and systems so that WFP could cover the transport and logistics of items for partner organizations, including items it does not ordinarily handle, such as specialized health commodities. WFP, with the support of Takeda and other donors, developed a new platform to answer this challenge, enabling it to plan, monitor and automate the distribution of a huge number of diverse COVID-19 related items. It also brought together in one place data relating to the various products being transported, as well as information on the hubs, transporters and partners' pipelines. Information from different internal and external systems and countless data sources was centralized within this platform. All partner service requests were processed in a timely and efficient manner, giving visibility at any moment on the cargo's location and status and facilitating more agile planning and decision making. It also sent out alerts for actions that needed to be taken in order to prevent delays in the supply chain. This activity was instrumental throughout WFP's COVID-19 operation, enabling it to transport over 130,000 cubic meters to more than 160 countries on behalf of 84 partner organizations. As you can see, data analytics are driving WFP's operational response, and this is a topic that will come up again in this video. In order to support the humanitarian community even further during COVID and ensure the ability of health and humanitarian workers to stay and deliver, WFP also built a COVID-19 field hospital in Accra, Ghana, with the support of Takeda. In partnership with WHO and the government of Ghana, in less than a month, WFP constructed a hospital to treat humanitarian and health workers suffering from the virus. In 1 year, patients from 43 different countries, working for various United Nations agencies and non-governmental organizations, were treated at this facility. A dedicated team made up of 130 Ghanaians, supported by 43 international professionals, were continuously trained to deliver the best quality of care to patients.
It's a very proud moment, not just for me, but for all the staff working here, once we have repatriated a patient and they're on their way on the flight back to their families. For the local staff, all the trainings that we do here around COVID-19 as well as other training programs, they take these experiences and knowledge that they've learned here and they take it into their hospitals where they usually work, and then they transfer this knowledge onto their other colleagues.
As we've seen, WFP's partnership with Takeda was crucial to help address the COVID-19 urgent needs on the ground. Another fundamental aspect of this partnership is looking at longer-term systems work, taking the learning from the unprecedented COVID-19 crisis and providing sustainable solutions to help prepare the response to the next emergencies. Since 2021, the partnership has focused on supporting ministries of health and central medical stores, which are typically the logistics arm of the ministries of health, to build the resilience of health supply chains, to make sure that local supply chains are strong enough to absorb health shocks, whilst at the same time continue to provide health workers and patients with vital medicines, treatments, and protective equipment. Over the past years, we've been working in collaboration with 4 countries: Côte d'Ivoire, Guinea, Malawi, and Zambia. At the request of national governments, we've helped assess the logistics gaps and needs in each one of these countries. We've then defined, in collaboration with the Ministries of Health, the tools and processes from WFP's logistics experience that could be shared and transferred to help strengthen local supply chains. In this video, we will be talking about 3 different activities that are currently being carried out in these countries. Firstly, we will learn about fleet management and how ministries of health are working with WFP to improve the transport of medicines to the many public health facilities across their countries. Secondly, we'll understand how supply chain analytics can help provide end-to-end visibility of the entire supply chain to ensure that the necessary medicines are in the right place at the right time. Lastly, we'll see how logisticians and humanitarian responders can prepare and rehearse the collective response to health crises and emergencies in order to ensure that they know how to use the tools and processes at their disposal to efficiently contain and manage disease outbreaks. Now, let me hand over to Jean de Crépy from WFP's Global Fleet team to tell you more about the way WFP is helping improve the transport of vital health products in complex environments.
In addition to working with commercial transporters in countries around the world, WFP also has its own fleet of trucks used to transport food commodities to some of the hardest to reach places on the planet. With more than 1,000 trucks in 24 countries, WFP has developed the expertise and capability to optimally manage the transport of food and relief items to challenging places. WFP's Global Fleet Unit is using this expertise to provide technical assistance to countries and national governments in need by sharing and adapting WFP's fleet management tools to answer local challenges, and by coaching and training government staff on fleet management best practices. In Guinea and Côte d'Ivoire, for example, WFP has been partnering with the government central medical stores till 2019. With a fleet of 25 vehicles, the Central Medical Store in Guinea is responsible for transporting and distributing essential medicines and other health items to hundreds of health facilities across the country. It's therefore very important for the Central Medical Store to make sure that its trucks are optimally utilized.
Ayant la responsabilité de distribuer les produits de santé, ça veut dire que nous sommes un maillon important de la chaîne d'approvisionnement de la République de Guinée. Alors, partant de ce principe-là, nous avons besoin de l'amélioration des compétences dans ces différents segments de la chaîne d'approvisionnement. Donc, on a estimé qu'auprès des PAM, on pouvait obtenir de l'expertise pour améliorer nos performances en matière de gestion de la chaîne d'approvisionnement.
Over the past years, WFP has provided trainings for the Central Medical Store staff on fleet management, eco-driving, security, and truck mechanics. WFP even brought in a cutting-edge truck driving simulator to create a safe and realistic learning environment. A fleet management system was also designed and developed to help Central Medical Store manage and monitor more efficiently the use of its fleet of vehicles. This tool is currently being deployed in Guinea, and it's already proved successful in supporting and enabling the Central Medical Store team to make more informed decisions. Let's zoom in and discover more about this tool and how it actually works.
With the support of Takeda Pharmaceuticals, a fleet management system called TOMS, inspired by WFP's fleet management tools, was designed and developed to fit the specific needs of public health supply chains. Through this tool, key fleet management data such as vehicle capacity, truck routes, cargo movements, distances covered, and fuel consumption are registered and displayed on simple yet powerful dashboards, providing real-time visibility of a fleet's operations. Key data is entered by central and regional fleet managers into a simple, user-friendly application, which can also be used in remote locations with limited internet connections, ensuring more reliable data entries. Data is synchronized, stored, and dashboards automatically generated, providing visibility of transport costs and performance indicators to support evidence-based decision-making. With TOMS, fleet managers have visibility of trucks' availability and can select the right truck at the right time, depending on the volume of cargo to be transported. They can choose the most efficient route based on past trucks' movements and fuel consumption, ensuring that products reach their destination in the quickest and most efficient way. Fuel consumption targets are defined and drivers trained on eco-driving to help reduce the consumption of fuel for every journey. Maintenance and repair activities are available in the system, with preventative maintenance schedules defined to ensure that trucks are less at risk of a breakdown, ultimately reducing overhead costs and improving efficiency. Training sessions on TOMS are provided by WFP to ensure that Central Medical Store staff are able to implement and use the tool autonomously in the future.
As you've heard from Jean, managing a fleet of trucks efficiently is extremely complex. Thanks to tools such as TOMS, which centralizes data, trucks can be used optimally and vital products delivered more efficiently to treat patients. Data is really at the center of each and every operation or emergency response. And WFP has been investing in data analytics for more than a decade now to help manage and improve its own operations. With Takeda's support, a team of WFP data analysts have also been supporting ministries of health in recent years to help them make more informed decisions, and especially data-driven decisions about their supply chains. I will hand over now to Malet Sahle, a supply chain planning officer, who will explain how data and analytics are helping governments ensure that the right products are in the right place at the right time.
Here at WFP, we use analytics to anticipate possible future issues and support countries to develop supply chain plans and scenarios to address these issues. Through this proactive approach, countries can make more integrated evidence-based decisions that improve overall efficiency and effectiveness of their operations. At the request of Ministry of Health, we've been adapting our own analytical tools and processing to answer the specific challenge of the health supply chains. In recent years, we've been working in collaboration with governments of Côte d'Ivoire, Guinea, and Malawi, and we've shared what's called a control tower approach, an approach that's widely used within WFP to manage emergency operations. Let's see more closely how the control tower approach works.
Making sure that vital health supplies are in the right place at the right time requires many decisions to be made. When should we buy products? Should we make an emergency order? Should we move stocks from here to there? Making the right decisions is key to avoiding supply chain disruptions and product stockouts. Over the last decade, the World Food Programme has been investing in data and analytics to manage complex humanitarian operations and deliver food assistance. In emergency situations, vast amounts of data must be treated quickly. It's therefore crucial to have a solid team of data analysts that can provide operational visibility and roll out what's called a control tower approach. Through this approach, WFP coordinates the various parties along the supply chain, collecting information and integrating data to provide end-to-end visibility and facilitate decision-making. That way, food and other relief items can be made available in the right place at the right time. The expertise and insights gained from managing such complex data sets uniquely position WFP to help governments make informed supply chain decisions. Working in collaboration with Ministries of Health over the past few years, with the support of Takeda Pharmaceuticals, WFP has shared and adapted its control tower approach to answer the specific needs and challenges of public health supply chains in complex environments. By enabling health programs to collect and integrate data from the many stakeholders along the health supply chain, from manufacturers to health facilities at the last mile, WFP supported government staff to develop simple yet powerful dashboards that help assess, plan and improve the availability of sensitive health products such as malaria treatments across a country. With clear visuals and projections, data-driven decisions can be made and stocks replenished or reallocated on time to avoid products expiring or running out. This ensures that every hospital and health facility has the necessary medicines to treat patients at all times. Training sessions on the control tower approach and tools were provided by WFP to ensure that governments could sustain this approach and deploy it to other health programs.
As you just saw, WFP works closely with the Ministry of Health to provide more agile planning and decision-making. The control tower approach was first implemented in Côte d'Ivoire to manage the country's malaria program. Through the use of better data and analytics and improved coordination, the Ivorian Ministry of Health reduced the number of malaria treatments stockouts by almost 1/3 in 2021. Concretely, it means that more patients suffering from malaria could access their treatments.
Taux de contrôle avec le PAM, en collaboration avec le PAM, nous a permis de mieux organiser nos réunions mensuelles, de mieux les structurer, d'identifier des actions claires et précises et de pouvoir attribuer à cela un chronogramme de résolution des actions identifiées.
Le tableau de bord nous présente une visibilité de la situation des produits des différents programmes au plan national. Le tableau de bord nous permet de prendre des décisions pour pouvoir éviter des probables ruptures. Le tableau de bord optimise la chaîne d'approvisionnement. En un mot, le tableau de bord a facilité nos différents acteurs à la prise de décision.
As the project came to an end in Côte d'Ivoire, WFP trained a team of people within the Ministry of Health so this approach could be sustained in the future and deployed to other health programs such as HIV and family planning. In the coming years, we plan to continue working with the Ministries of Health and other African countries, including Malawi and Guinea, to implement similar approach and help improve the availability of essential health products.
As my colleagues have shared, innovative tools and processes, such as the Fleet Management System TOMS and the Control Tower approach, are pivotal in ensuring that supply chains can run smoothly and efficiently, especially when faced with unexpected circumstances and extreme pressure from outbreaks, natural hazards, or even conflicts. This is all to make sure that patients can continue accessing their treatments at all times. Another crucial aspect is to ensure that logisticians and emergency responders are efficiently prepared to face difficult situations so that supply chains can continue operating when crises strike. One of the tools that WFP is using to prepare its own teams to respond to emergencies are simulation exercises. Simulation exercises, or SIMEXs for short, have been used to prepare for and rehearse the response to humanitarian emergencies for many years, and WFP has a long-standing expertise in providing this type of trainings to prepare supply chain professionals. Let's hear now from my colleague Guillermo Cuervo, a supply chain training officer. We want to learn more about simulation exercises and how they can be applied to the health sector to support health emergency preparedness.
My name is Guillermo Cuervo, and I have been working as a training officer for WFP-led logistic cluster for more than 1 year. One of the key aspects of my role is to develop and implement simulation exercises to train WFP staff as well as those of other organizations and governments to better respond to emergencies such as natural disasters. In 2022, we started working in collaboration with ministries of health and their agencies for emergency preparedness and response, adapting our training methodologies to the context of health emergencies. 2 large-scale simulation exercises were conducted in Côte d'Ivoire and Malawi with the response of Takeda. To help prepare health actors to face disaster outbreaks in Côte d'Ivoire, 70 participants were immersed into a fictional avian flu outbreak scenario and forced to plan and implement a complex operational response under pressure while subjected to real-life constraints. They actually use existing supply chain procedures and tools and acquired new competencies that are essential in answering public health emergencies. Now, let's see in more details what a simulation exercise encompasses and how it is used.
When a crisis strikes, it's not easy to know how to respond. Most of us wouldn't know what to do when facing one. By practicing and rehearsing our actions, we can react faster and more effectively when a crisis presents itself. Responding to public health emergencies is no different. That's why simulation exercises, also called SIMEX, are used by emergency responders to prepare ahead of time to respond more effectively. Making sure that supply chains do not break is one of the most important parts of a response. So that health supplies, such as medicines or protective personal equipment, can continue reaching the health workers and patients that need them. With decades of emergency response and supply chains operations experience, the United Nations World Food Programme is joining forces with African governments to train and prepare local humanitarian and logistics actors facing health disasters in Côte d'Ivoire and Malawi. In 2022, Ministries of Health, local health and humanitarian actors, and WFP experts organised workshops to review and update the country's emergency response tool and define roles and responsibilities, protocols and procedures to be followed in a crisis. In 2022, coordinated by WFP and with the support of Takeda, this theory was put to use during a multi-day simulation exercise, recreating the first weeks of a pandemic emergency in a safe and constructive environment. Out of the classroom, the SIMEX created conditions where participants were given the opportunity to respond to a fictional emergency. Forced out of their comfort zone, they had to make decisions in real time under pressure and were able to learn from the consequences. When the next emergency happens, responders will be able to call upon their training to respond faster and more efficiently.
As you have seen in this video, simulation exercises are used to train participants by confronting them with fictional yet realistic situations to which participants are asked to respond. The scenarios used must be adapted to the context of each country, and it's important to involve the various actors who will be required to coordinate the response in case of a real emergency.
Donc, les exercices sont planifiés de sorte à permettre aux différents acteurs de pouvoir s'exercer, d'être mis en situation de sorte que, en cas de survenue d'une épidémie ou bien d'une situation de crise, les différents acteurs sachent quel rôle ils doivent jouer, quelles décisions prendre et comment interagir avec les différentes parties pour que la réponse soit bien coordonnée.
In Malawi, the scenario developed was slightly different to the one created for Côte d'Ivoire. Malawi is regularly hit by cyclones, bringing heavy rains and floodings, which often leads to damaged infrastructure and disrupted water and sanitation system, a recipe for cholera cases. Therefore, the simulation exercise conducted in this country recreated the first week of a cholera outbreak, helping national actors to prepare the responses to the highly probable situation.
Malawi has dealt with many epidemics. There is COVID, which is still going on, and as we speak now, there's already cholera. Malawi by itself cannot manage all these epidemics or emergencies that come along. To do that, we forge partnerships. There is UNICEF, there is WFP, and many others that come to help Malawi build the capacities as well as manage the disasters. The central point in most cases is to save lives. So to prepare means to avoid as many losses of life as possible. So basically, it's a must to prepare for eventualities and emergencies.
The simulation exercise really put us in the real situation. There's lots of pressure, there's lots of stress, but at the same time, it is expected of you to perform. This is a holistic and rigorous exercise. It brings out essentials of logistics management, especially during disasters. It is a training that is focusing on how to coordinate, how to share information, how to manage transport and logistics during a disaster to ensure that you reach your beneficiaries in time. We have worked as a team. Maybe in the beginning it was a bit slow to get to know each other, to appreciate different interpersonal skills, but later on we normalized and then began to perform. I feel that this is the way that it should be, even during disasters. We should be able to work with different stakeholders, pull our resources together, prioritize together, and then implement.
Simulation exercises are a very important, concrete tool that can help a country strengthen its supply chains and prepare for the eventuality of an emergency. It's of course not the only one. It's part of a range of activities, tools and processes that can be developed and practiced locally. In Côte d'Ivoire, Guinea, Malawi and Zambia, other types of activities will also be implemented in collaboration with and at the request of Ministries of Health through WFP's partnership with Takeda. Starting this year, we will be working on improving the storage capabilities of central medical stores. We will do that by providing best practices on warehousing management and training to local government staff. We will also be working jointly with local governments on a pandemic preparedness platform. The platform will help overcome common response constraints and optimize decision-making. This dynamic, innovative digital tool will combine multiple information through crowdsourced updates from affected areas. At the same time, these information gaps will be validated real-time to generate a common operational picture. We'll also be working on the development and deployment of a pandemic mobile response station in collaboration with other health partners, such as the World Health Organization. These mobile response stations will aim to reduce the burden on local infrastructures in the event of an emergency. We look forward to continuing our 5-year partnership with Takeda to save lives and change lives and to bring better health to people.